Hello viewers, welcome to our channel. Today Dr. Swapna Priya is with us, dermatologist, cosmetologist and trichologist at Care Hospitals, Banjara Hills. Hello doctor.
Hello.
Doctor, how much amount of hair fall per day is normal?
I see many patients who are concerned about the hair fall these days. But first I would like to educate the patients like how much amount of hair loss per day is considered to be normal and beyond which limit they should be worried and they should approach the doctor. Every person's hair actually has three phases actually, a resting phase and a growing phase and a falling phase. So all the persons will have at least a minimum of 60 to 80% of the hair in a growing phase, 10 to 20% in a falling phase and 10 to 20% in a resting phase. So based on this proportion, every person is likely to lose 50 to 100 hair per day and they need not get panicked with the number of 50 to 100. Any number beyond this is definitely worrisome and it is a right time that you take the opinion from the doctor and start any treatment for your hair fall. Actually, and one other rough way of estimating whether your hair fall is problematic or not is I would ask them to put their hand into the scalp, and when they pull their hair at one point of time, how many hair they say in their hand is one right indication to know whether your hair fall is really to be worrisome or not. If you are seeing more than 5 to 10 hair which come easily when you pull your hair, is definitely worrisome, and I would suggest you meet your dermatologist or a trichologist to solve your problem.
Doctor, what are the causes of hair fall?
The hair fall reasons are very varied and it can start by a simple nutrition problem to a very major reasons like illness or any cancer also. But we would like to discuss to start with very simple problems where I see every day in and day out, any person coming who is having a hair fall. To start with, the most common is a nutritional causes of hair loss where I see, and more so particularly in females, because in India I see every female not even having a proper hemoglobin level. Most of the patients are below the normal level. They have around 8 to 10, particularly in the females of marriageable age or post pregnancy. This problem is very common. I see them to have very low hemoglobin, or because of the crash dieting or loss of weight, this hair loss becomes very severe and they feel very bad at that point of time. So first we need to correct all those issues before we plunge on to the other treatments. And next come the micronutrient deficiencies like biotin, vitamins and minerals, copper, all those things, because these all have a role in the hair growth. Zinc, all these things also help in the hair growth actually to say. And the next common reason I see, their hairstyling habits. I see they don't have a proper hair wash habits, or they use hair drying, blowers, ironing, hairstyling gels and all those things. Or another is hair straightening, where they do either by using permanent hair straightening methods or by ironing also. Either of the methods comes with a tag that they are associated with the hair loss, and that should be known to every person who is accepting that they want a hair straightening before they plunge upon it. And the next thing comes their hormone related problems like thyroid issues. Either it can be a hypothyroid and a hypothyroid, or sometimes they have a PCOS problem that is called polycystic ovarian disease, where they have some menstrual irregularities and sometimes increased hair growth on their face associated with the hair loss on the scalp. And in this pattern of hair loss, I see they have thinning of the hair in the center of the scalp, or partition line is becoming more wider and wider, and the scalp starts becoming more visible. These are the symptoms which suggest that definitely they should now intervene and take some proper treatment to stop this issue of the hair fall. And next comes the other causes which are very commonly seen as post-pregnancy, that is post-delivery, where I see the people having severe hair loss. Actually, this is a norm that post-delivery every patient will have a hair loss. But if it is not getting controlled within 6 months to 1 year, definitely it's time to intervene, where we support the hair externally by using peptides and nutrition supplementation to decrease the amount of hair loss what they have postpartum or post-delivery time. And the other common reasons is hair dyeing habit, where they use different types of dyes which can increase the type of hair fall. You need to check upon it, and they have any dandruff issues. Sometimes a severe form of dandruff which is called seborrheic dermatitis can also lead to the problems of hair loss. These all things should be watched upon, and any major illness patient had in the last few months, like 1 to 2 months, is important, because the nutrition would have been a lot affected during that time, and which would be seen later as a hair loss. Any severe viral fevers or post chikungunya or a dengue fever, we see very commonly the hair loss. So definitely taking some support from the doctor by using some serums and tablets would definitely help to solve their problem of hair loss.
Okay.
Any major illness like during the cancer chemotherapies, or sometimes following their renal problems or diabetic issues, or sometimes even following the liver issues also, people experience hair loss. Okay. So it is definitely right to meet a dermatologist to take the opinion of their hair loss and then to intervene about it.
Doctor, what are the treatments available for hair fall?
The treatment start with the medical treatment usually. We ask them to use everyday shampoos or in a milder form if they have a habit of washing their scalp every day, and then starts with the oral medications in the form of biotin, iron, zinc. All these things are important, and these days we see even vitamin B12 and D are also playing a role in decreasing the hair fall, because every person is having the these deficiencies very commonly. So supplementation of all these also is giving a change in the scenario of the hair fall. And additionally, we then suggest them hair peptides, which is the Procapil, Capexil, all those combinations, which will help to decrease the hair loss. And this has to be applied mainly to the scalp by giving a partition of the hair and then applying to the scalp and giving a small massage into the scalp. And this has to be done every day very sincerely to see the changes, obviously. And it takes a minimum of 1 to 1.5 months to see these changes. And many people do ask me the question, is oiling required for my scalp? What type of oil should I use for my scalp to decrease the hair loss? To say truly, no studies have proven that any particular type of oil has advantage over the other to decrease either your hair fall or to increase your hair length. This acts actually as a conditioner to prevent and protect your hair from the external pollution and all those things, and also prevent the damage of your hair because of the shampoos what we do. Definitely oiling of your scalp will help to smoothen the hair post your head wash and have a nice soft feel of your hair. This is one important thing which people should know. And how frequently should I wash my scalp is the next question to save your hair loss. One thing is minimum weekly twice washing your scalp is definitely required in any person, whether it's an oily or a dry scalp. If it is an oily scalp, even daily wash can be done, but in that scenario, anti-dandruff shampoos which are so harsh or strong are not required every day, which can be replaced by using a milder shampoos which are sulfate free for the daily wash and a stronger wash for the weekly twice basis.
Thank you so much, doctor. Thanks for the information. I hope you like this video. If you like it, please like, share and subscribe to our channel. Thanks for watching.